Hello, it's Dr. Chris Marshall here again at Medical Specialty Clinic. I wanted to talk about neuropathy today. I've had patients for years and years that have to deal with terrible neuropathy. So if you have it, then you know what it is. But if you don't know what neuropathy or that medical term means, it usually refers to a terrible pain, usually in the legs and feet, that is like pins and needles sticking you in the skin, or that kind of painful tingling that happens when your arm or foot goes to sleep, things like that. Well, there are people that deal with that every day on a daily basis, and it can be quite debilitating, very hard to deal with. It can be caused from many different things. Diabetes is a major cause. The inflammation from insulin resistance and glucose, things like that, can damage the nerves. The same things that damage any blood vessels can also damage the nerves. So the nerves, if they don't get adequate blood flow and nutrition, and they aren't able to get rid of all the toxins that are built up, then that can damage them. And one of the first signals they typically send is that pain signal that's like pins and needles, tingling, numbness, very painful sensation, and sometimes that is constant, and usually it comes and goes, but a lot of times eventually it becomes a constant pain. It can be quite painful to deal with. There are several treatments that we use to help with that. Of course, anytime you have neuropathy, if you can treat the cause of the neuropathy, then you want to do that, rather than just treat the symptom of neuropathy or treat that painful sensation. Some things that we use in medicine to treat that are Cymbalta or duloxetine, which is an antidepressant. It can actually help with pain. Lyrica is another, that's pregabalin. So Lyrica is FDA approved for peripheral neuropathy treatment. It can help some, but a lot of times you get used to it and it may not last long term. Lyrica or pregabalin is an option, and then you probably heard of Gabapentin or Neurontin. That is typically taken anywhere from once to 3 times a day, and can also help with that sensation. It is actually a seizure medicine. Initially, is when it came to market, it was a seizure medication. We typically don't use it for seizures. There's better medications for that, but we still do use the Gabapentin for neuropathy treatment, and it can help quite a bit, and its effects can last long term, but it can have the side effect of drowsiness, and it can make you a little off balance or impaired feeling, and a lot of times people don't like that. It doesn't always do that, and many times you get used to it and can take it fairly well, but it is also a controlled substance, so there is some risk of habit forming and misuse that we also have to take into account. But in general, it's a very safe medicine with a wide dosing range. So you can take anywhere from small amounts, 100 milligrams, up to 800 milligrams 3 times a day. So it is a good medicine. But really the main reason I wanted to get this video out there is not so much to talk about the prescription medicines for neuropathy, but some of the things you can do to help protect yourself from neuropathy, and if you do have it, some things you can do to support metabolic health and decrease the symptoms of neuropathy. So a lot of times you want to make sure that your B vitamins are adequate. So a good B complex vitamin can help, in particular B12 and folate. You want to take those, and also thiamine can help. So there is a product that I've been using a lot lately, and that's what I wanted to let you know about, and it's a product by Vite, and it is a combination of benfotiamine and alpha lipoic acid. These help support nerve function and can actually help quite a bit with painful neuropathy. So the benfotiamine sounds quite complicated, but it is simply a fat-soluble form of thiamine, so it's more bioavailable, a little bit better absorption, gets in the body, does what it needs to do a little more efficiently than just plain thiamine supplements. So the other is alpha lipoic acid, and that is a strong antioxidant, and that people have been using for years to treat neuropathy. You can actually get an IV infusion of alpha lipoic acid if you have severe neuropathy. That might help. Insurance may or may not cover the IV infusions, but typically these vitamins that are over the counter work very well. I have this in the office, but it is also available at most major retailers. So Amazon, you can get it. So it's Best Vite benfotiamine with alpha lipoic acid. So that is a good option to try if you have neuropathy and want to avoid prescription medicine, or if the prescription medicine is just not helping enough. And just one more point I wanted to make. So if you do have neuropathy, it might be a good idea to ask your doctor about a methylmalonic acid test or homocysteine level. Checking these with peripheral neuropathy, kidney disease, anemia, things like that is a good idea, because it can be a sign of things that may need to be addressed. Anyway, that's it for now. I appreciate you tuning in. I look forward to seeing you in the next video. If you have any questions or would like to discuss this more with myself or one of the other providers here at the office, just give us a call, 731-257-1500. And of course, you can find us on the web, medspecialtyclinic.com. We'd be glad to hear from you. Thanks again.